Would you all please rise for the Pledge of Allegiance? Legislator Edmuzio, can you lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Legislative Clerk Mary, could you please call the roll?
Present.
I'm here, thank you. Tonight we have a proclamation for recognizing the Putnam County Youth Bureau and Haldane School District on their youth-led 9/11 memorial. I know that we have Janine Cunningham here, the Putnam County Youth Bureau Director, also Kimberly Rialto, Putnam County Youth Deputy Director, and Chloe Lex is here. Maybe I'll just come over there because it's kind of awkward here with all of this in between us, I think.
I'm just going to sneak by.
I know.
So maybe we'll ask Mary how we should face things to be on camera for all your folks at home. This way? Okay. Thank you. Thank you for coming tonight. Of course. I kind of like this doing it in committee. So hi Chloe, nice to meet you. Thanks for being here. Tonight we recognize the Putnam County Youth Bureau and the Haldane School District on their youth-led 9/11 memorials. Whereas on September 11th, 2001, the peace and security of our nation was shattered by terrorist attacks that killed nearly 3,000 innocent people. 19 terrorists hijacked 4 commercial airplanes, crashing them into both the north and south towers of the World Trade Center in New York City, the United States Pentagon in Virginia, and the pristine fields of Shanksville, Pennsylvania. And whereas although the terrorist goal was to tear at the fabric of our nation, arising from the very ashes of that tragedy came a remarkable spirit of unity, compassion, and determination that will never be forgotten. Many brave individuals tirelessly participated in an extraordinary, difficult, and dangerous rescue and recovery effort, in some cases voluntarily putting their own well-being at risk. Each year, the anniversary of the attacks is a sacred day, both in Putnam County and throughout the country, as citizens honor the memory of all who were lost on that day. And whereas the Putnam County Youth Bureau, recognizes the importance of introducing this tradition to the younger members of our community, the Youth Bureau will host their 6th annual Youth-led 9/11 Memorial, where youth volunteers will commemorate the 25th anniversary of September 11, 2001, attacks on our country by reading aloud the names of all who lost their lives on that day. This year, the Putnam County Youth Bureau, in partnership with Haldane School District, expands its reach by synchronizing youth-led memorials on both sides of the county in honor of our fallen heroes. Now be it resolved that the Putnam County Executive and the Putnam County Legislature hereby recognize the efforts of Putnam County Youth Bureau and Haldane School District, and encourage residents in Putnam County to participate in the youth-led 9/11 memorials. The public is invited to attend the memorial at Putnam County Bureau of Emergency Services, while the memorial at Haldane School District will be limited to students, faculty, and community officials. Signed, Kevin Byrne, Putnam County Executive, and Daniel G. Birmingham, Chair of the Putnam County Legislature. Thank you for all your efforts in keeping this tradition and memorializing those we lost and honoring them. I really appreciate it. Thank you.
I just want to thank the legislature and the county executive for the proclamation. You're all invited to your emergency services September 11th. Chloe Lex is a senior at Maypac High School, so she will be, last year participated and will be participating this year. Usually the students read the names of the fallen from Putnam County and the names of the fallen since 9/11. We have student essays, so please come, attend, all welcome.
It's a very moving ceremony. I mean, a lot of us watch it on TV, but being here present in Putnam County with the youth and future generations to never forget. Thank you.
Thank you.
Thank you so much.
So we have item number 4 on the agenda is the acceptance of minutes from March 11th, 2026 meeting and April 8th, 2026 meeting. We don't need to move that. And next on the agenda, number 5, is just a brief update from the chairwoman. That's me. As many of you know, we passed the Food Security Initiative following the legislature's $150,000 approval to Second Chance Foods and Cornell Cooperative. They are working with DSS and the Office of Senior Resources on the implementation plan today. Actually, yesterday I received an implementation plan from Second Chance Foods that was shared with Cornell Cooperative and DSS and OSR. So we're looking forward to that collaboration and those funds moving out into the community. There was also great news. Great news. How do you say this is great news? New York State Office of Mental Health announced $660,000 for suicide prevention efforts in New York State counties, including Putnam. And Putnam will receive $36,000 initially and $48,000 annually for the following 2 years. And they will be building on the work of Suicide Prevention Task Force that is very effective, and the LOSS team. And if you haven't listened to the legislative meetings where they present their programs, I encourage you to find them on our website because it's a very meaningful program, and I'm really happy that New York State sees the value in it and can boost these resources. Just a couple of things that I am keeping an eye on, and I hope my colleagues will as well, regarding federal health and benefit changes. Something we really need to watch because it will affect us as legislators in Putnam County and ultimately taxpayers. So the essential plan is affecting health coverage for hundreds of thousands of New Yorkers beginning October 1st. The federal share of SNAP benefits administrative costs drops from 50% to 25%, potentially shifting that substantial cost to counties, increasing pressure on DSS and more pressure on local food programs. So the $150,000 that we just allocated is a drop in the bucket for really what's needed throughout the county. There are broader Medicaid changes that will continue to roll out over the next several years that could affect coverage, providers, and demand for more county services. And then there's always opportunities. New York has received more than $212 million for the first year for federal rural health transformation program. And I want to make sure that Putnam is looking at any opportunities available to our health department and local partners. And going forward, I just want to stay ahead of these changes, identifying funding that may be at risk, as well as new state and federal resources that Putnam should be pursuing. So that's my update. And then next on the agenda, we have item number 6, which is the approval for Budgetary Amendment 26A067 from the Department of Health for new Early Learning Center program. And I think we have Ran Rodriguez here if you want to just speak to it. It's pretty straightforward. This is our Early Learning Center that oh, we have Valerie here too. Nice to see you, Valerie. Nice to see you. Thank you. So take it away. I'll hand it over to you.
Sure. So good evening. Once again, we are here to request a budgetary transfer to cover some of the costs associated both with our establishment of the new 4410 class as well as some additional costs associated with your learning center. So we have both Ralph here as well as Bill Orr, so we can go through any concerns, questions, or comments you may have.
No, oh, Valerie, go ahead.
I was gonna say, want
Yeah.
me to explain what a 44?
Sure,
We just
sure.
gonna ask.
That'd be great.
But not yours. Okay, so, as you know, the Early Learning Center is doing really well. We are booked, we're booked for the summer, we're booked already. We have a waiting list. It's really doing quite well. But we have noticed that there are some children that even are struggling in the Early Learning Center where they may need a little bit more one-on-one that is, like the typical programs that we have in their community. such as, Park, Easter Seals, UCP, all those wonderful programs. So I worked with the state and I came up with, just one class of, what we call a 4410, which is approved through New York State Department of Health, and it's 8 students, 1 teacher, and 2 aides. So these students are from Mayapack, Brewster, and Carmel, and Putt Valley right now. And Haldane, sorry. So it's all over Putnam County, and they're the children that are just shy of having those skills, being able to be in their early learning center as inclusive with the other students. So I wanted to give them also an opportunity to see, it's like a pilot, to see how that's going to go. So it's a little bit more structured class for them in hopes that we could integrate them for art and gym, and then eventually move them into the ELC. So to giving them 3 or 2 years opportunity to have the Carmel Central School District curriculum, giving them an opportunity to be successful in kindergarten as well.
Thank you for that. I'm just so happy this program is up and running and that you're looking at new ways to make it easier for kids to be included in the classroom. Have you had any feedback from parents? Like
Parents love it.
this particular idea, the
Yes,
pilot?
they love it. We actually have a waiting list for the 4410 as
Okay.
well. So, it's insane. But
Yeah.
they all want to stay in Putnam. They all want to be, their child be inclusive. They're
Mhm.
feeling that if they go to the other programs, although very, very good programs, but they all stay in that particular class all day long. And there's no movement. There's no integration with other children, that, may not have any disabilities. So, and they all want that for their child. So, that's the feedback. that we
Great.
get.
So great. Thank you. Legislator Adnisio, do you have any questions
No,
or
I
comments?
think this is great. So this will be actually a new classroom that you're setting up with the 8
Yes,
students.
within the ELC.
And how many are on the waiting list? Do you know, for this
Right
particular
now,
program?
We're gonna open it in September, and we already have 4 children on the waiting list.
Waiting.
Yeah.
Wow. And how would they get on? I mean, when
The
somebody,
school districts.
no, I'm saying if they're on the waiting list, can you fit them in the program?
cannot
That's what I'm
right
saying.
now.
That's what I'm saying.
Yes, there's no program available right now for any of the children, so, but, yeah.
Can I ask how many are on on the waiting list for the overall program, not the 4410s, but
The overall program,
Sorry.
because our new building isn't complete yet, so we have about 12 children on the waiting list right now.
and you expect that building to be complete?
Well,
Mhm.
we were told that it would be complete at Thanksgiving, and, forgive me because I'm not a contractor, but it's trusses. They're
Oh.
still waiting for them, and once they come in, it'll go, but they're assuming it's going to be now, into December.
Okay. Any other thing? Anything from the legislators? Legislator Sage.
Thank you, Chairwoman. I have one question. How many students are currently enrolled in
For September?
for September?
For September, we have 43 in the ELC and 8 in the 4410.
And when the new building is complete, that'll be,
We'll have room. We'll take all those that are on the waiting list, because we could hold, it'll be what, 97.
and can I ask one more follow-up
Sure,
question?
please.
So then if there were 97 students, I'm sure the cost is going to incrementally increase at that point. Is there a budget set up for that for November? I guess it would be.
For 2027, Bill and I
Yeah.
have been working side by side. He loves me. And we have been figuring that we would slowly end up increasing. I'm sure I'm not going to get 97 right off the bat. So I'm thinking that we would move to like 60 and then 70. But yes, we've looked at that for the 2027 budget.
Okay, thank you.
Legislator Crowley.
Thank you, Chairwoman. I think it's awesome that you guys are including this. I think those are more of our vulnerable population, and by taking them off the bus for longer periods of time to travel even further, is incredible. I hope that we have more than one classroom for these kids. I love the work that you're doing. Again, I wish my kids went there. You were in my kitchen when they were born. So the fact that I'm seeing this unfold and the success with it and continued programs and continued initiatives are just remarkable. And you're really doing a service to these families and to these children and their needs. And I can't thank you enough. So I appreciate it. I'm full support. Thank you, Chairman.
Legislator Birmingham.
Yeah, just a quick question, more of a fiscal technical question, so I'll either put it to you or through the chair to Michelle or Bill. I see that with respect to the revenue line, the offsetting amount is, of course, the same as the expense. It is education transportation. Is that because we're spending less money on transportation and that's where the money's coming from to fund this?
It's twofold. It's we receive $54,000 per child. Okay, so times 8, that's the amount of money we're going to receive, and that offsets all the other costs. The least transportation in there is a percentage based on kids that are going to be on the bus of the 4 different programs: early intervention, pre-K, ELC, and 44.
In this per capita grant we get per child is for transportation, is that allowed to under the, I'm sure it is, I just like to educate myself. It's allowed to be spent on things other than education, like the office supplies and printing and
Yes.
forms?
Yes.
Okay, good. That's all I wanted to know. Thank you. Thank you.
I have another question. Thank you, Chairman. Considering we potentially have room for 97 students, and we'll probably fill that to capacity at some point when the building's done. And I know that was in the original plan. We're not going to go back on that. But in the meantime, considering geographically, you know, for example, my district is still in the same position as they were when we had to transport those children down to Westchester or, you know, very far distance. Is there any planning for bringing this program to District 1 and District 2 in Putnam County?
Yes, actually, I have a meeting with Mahopac Central School District on the 20th of next week, I guess, and then Putt Valley would like to have a meeting with me. Haldane also. So we are looking. He tells me that I have to wait until this building is built. That I have to stop with my ideas. But I would love to do that, and I have so many ideas, and I have people that want to work on that side of the county. So as you know, and as I'm sure you know, is like Putt Valley and Haldane, they really don't have room for extensive UPK and for their children that have, you know, different abilities. So I would love to do that because even coming across county is a long bus ride. So if we could, I would love to start looking at that next year. But I would have to look at space first.
Yeah, and is there ever a collaboration with the school district itself? I know we
Yes.
have preschool in our public schools now. I know enrollment in some of our districts is way down. Does that leave room, say, for a program like this to be actually on the campus of the
That would even be better.
the K through 12 that Haldane is, or the K
Right.
through 8 that Garrison is? And I know, you know, for some of these schools, enrollment is way down. Some it's not. So, and it would depend on the year. So,
Right. So like I said, with Mahopac, I have that meeting on the 20th, and they have like 4 or 5 UPK classes within their building, I think on Myrtle Avenue or wherever that is. But they want me to help them do something what I've done over there. And I have been in talks with Putt Valley and Haldane because Haldane and Garrison are now together. So if we could, Garrison should have room, I would imagine. I know Haldane, the last time I spoke to them, they didn't really have any room within yes. So, but yeah, that is in the next couple of months, if we could do that, that would be absolutely great because if you look at them historically, they have probably about, you know, anywhere between 2 and 10 children that would benefit. So if we could get 1 or 2, even 1 or 2 classes with and integrate them with the UPK over there, that would be great.
that would be great. As I said,
Yeah.
you know, in the beginning of this to Rian and Valerie, that was probably the most frequent call I got as a legislator from constituents who had children that needed this program, but unfortunately their kids were on the bus for hours a day, and that's very stressful for a parent and for a child. Anybody else on the legislature have any more comments? Anyone from the public? Great. With that, I'll entertain a motion to amend 26A067 budgetary amendment for the Department of Health for the new Early Learning Center program. Can I have a second?
Second?
Is that okay? Mary, I moved it. Tony seconded it. All in favor?
Aye.
Thank you. Okay, next on the agenda.
Thank you.
Thank you so much. We have other business from the Health Department. What did I do with it? Okay, here it is. This is for the transfer from early intervention evaluations in the amount of $60,000 to early intervention care at private institutions and early intervention evaluations to early intervention assistive tech. And there's zero fiscal impact. And that was $3,000. So, can you take it away on this?
The explanation is below.
Okay, great. You want me to read it? I'll read it.
Or do you want me to
Unless-
just, you want me to just explain?
Sure. Bill, do you want to read it? No. Okay.
I could just quickly explain it. So, you know, the way that we look at the budget line, you know, the evaluations for early intervention, we had a little bit of extra. So I don't know how, but I miscalculated. But the Care at Home institution is early intervention. New York State's had stopped doing groups a certain way. So a lot of the programs, UCP, Westcott, Park, they all pulled out of doing like a program for early intervention students. There is absolutely none except for one, which is Los Niños in Valhalla. So our children don't want to go all the way down to Valhalla for 2 hours. You're on the bus for like an hour and a half for a 2-hour program. So I spoke with Los Niños because we do have children in early intervention. As you know, they're going to CPSE, so they are children that have high needs. So I talked to Los Niños, and they are bringing classes to Putnam County. So they will be helping us. So if that is the case, we calculated how much per student they would be able to do. It would be like 6 students in the morning, 6 students in the afternoon, and that would be the cost is approximately $60,000. So that answers the top one. The bottom one is early intervention assistive tech. We are seeing more and more children that are deaf, blind, and as we all know, the iPads are a big thing right now, and they're being used for communicative devices. So, you know, we have been finding even in our CPSC, our preschool program, that our assistive tech line is really getting hit because more and more children are really struggling with either communicating or, you know, like I said, that are deaf. So that is why we have those transfers.
And it looks like there's an increase to 9 children this year. At first, there were no children.
Yes.
4 currently enrolled, and now it's increased to 9. So
Yes.
that is also the additional cost.
Yes.
Thank you. Thanks for the explanation. I don't have any further questions. Legislator, any legislator? Sure. Legislator Crowley?
Thank you. So you just named a couple of schools that we were using for, you know, relying on for a lot of kids.
Yeah.
So thank God that we're gonna have the LC growing. Do you intend on growing the 4410 program more to meet the needs of children in the future now that we don't have these schools that are closer by to meet those needs? They would either go to ELC for a secondary program or a secondary classroom or be traveling even further.
I would love that. as Bill would say, it's a budgetary nightmare because the New York State Department of Education designates like how much per child that you get, and then it has to be dispersed, and you have to do like every year you have to do some kind of budget where you have to even like part of my salary, part of everybody's, the program manager's salary, as well as the books and everything like that, all have to be. So we wouldn't, I don't know if we want to say now, but financially we would need help, like organizing all of the budgetary lines.
But yes, we would like to utilize the current 4410 as proof of concept here, but ultimately to be able to replicate this portfolio of services throughout the county, right? So wherever they're needed, regardless of proximity and or distance, what we're trying to do here is utilize the ELC as sort of that learning laboratory, right? So once we see that this works, and we're quite confident at this point that it does, which is why we're moving forward with, creating this, following the philosophy of least restrictive environment, right? So we can progress our students. But ultimately, once we have outcomes that we can show indicating that this does work, we certainly want to be able to replicate this portfolio of services throughout.
Yes.
Sure.
Thank you. Why, do we know, is there a reason why these schools that have been, we've depended on for so long are now no longer using or
Doing early
doing-
intervention?
Yeah.
Yes.
Is it the statement from the
Well,
state?
New York State Department of Health doesn't pay. They haven't raised the rate. As well as they decided that if your child goes to a program, which is you see a teacher for 2 hours or whatever, you cannot see OT, PT, or speech during that time because it's double dipping, and that's now Medicaid, right? The whole rule came down. But before, you would be pulled out for speech and OT and PT during that time, during that 2.5 hours. But New York State stopped that. So now the programs are like, it's not sustainable financially for them. So they all closed their doors.
Thank you for that. Thank you, Chairman.
Thank you. Anyone from the public would like to comment on this? With that, I just want to say thank you for rolling out this and the foundation for this great program for Putnam County. It's nice to see it really growing, and your great program. I will make a motion to transfer the early intervention evaluations and early intervention care at private institutions and assisted tech in the amount of $63,000. Can I have a second?
Second.
All in favor?
Aye.
Wonderful. And with that, I would like to invite Fran Rodriguez for other business to give us, expand on my chairwoman's update, just to give us some insight as to what's coming down the pike in the health department.
Great. Well, thank you, Legislator Montgomery. This was really meant to just be informational, both to this legislative body as well as the Putnam community at large. So we've posted the final local solid waste management plan on our website. It is our intention to submit for a formal recognition and approval next month, but we wanted to give both this body and the public time to read it. So it is available on our website, and we just wanted to make that information public, as we're hoping that once we can get that formalized, we can certainly start moving forward to some of the issues that have come up that we're hearing about, especially around starting out with food scrap recycling, which is kind of where we're hoping to kind of at least initiate services. So really excited to get things moving in that space. So just wanted to make this body aware as well as the public.
That's great. Can you remind me of the health department employee's name who helped roll that out? And we had that great presentation here.
Savannah Usher. She is our solid waste management plan manager.
She made solid waste look interesting at that presentation somehow.
Yes, she makes trash sound exciting. That she does.
Tell her we thank you and thank her for and congratulations on getting that done.
Great, thank you.
With that, I don't have any other business. I'd like to make a motion to adjourn the meeting.
Second.
All in favor?
Aye.
Thank you. We'll be right back with personnel. Stay tuned.
Welcome to the Personnel Committee, August 12, 2026. Please stand for the pledge. Legislator Sage, can you lead us? Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Roll call.
Present.
Present. Yeah, it is. Can you hear me? I think this mic is very low, but I'll have to talk. Close.
Closer, maybe.
Okay. Moving on to number 3 is discussion for the retiree health insurance cost. We discussed this last month, and I see several folks here this evening that are very interested in this. And I would like to see a fair proposal to demonstrate that Putnam County values its workforce. And I know many people have worked 20 years here, even 30 years. 40, 41. And I do understand that some people started when they were 18 and worked 30 years. So now they're 48 and want to retire, and you can't because of the cost, because you're not 65 yet to get any benefits of Medicare. So I would like to see something move forward out of this committee. You know, we want to show that we do value the Putnam County employees. The other thing that I was thinking about is that, you know, besides having the experience and dedication that are very valuable to Putnam County, by reducing the employee insurance contribution, we will be rewarding longevity and dedication, also helping to retain employees. But most importantly, too, is to strengthen recruitment, which we are having a little problem with. So I think that when somebody does leave after working here for 30 years, it opens up the door for somebody new to come in. And when they do come in, it will be a savings to Putnam County because they will be at a lower rate than the person that just recently retired. So I don't know who would like to come up and speak on any type of proposal that you have been thinking about. Just state your name. Yeah, you can both sit there.
Is the
Hi.
green light on?
Aileen Napolitano.
And
John Mulroney.
we know who you are, but we would just want everyone to know. Okay. Okay, so I know we spoke about it last month, so have you come up with any ideas or proposals that you...
Yes, so I was afforded the opportunity to start at a very early age. I was 21 years old when I started at the Department of Social Services, and I worked for 33 years, and I was able to retire. I reached age 55. I worked a little past that. However, I am not quite at Medicare eligibility yet. And unfortunately, the cost of the insurance is astronomical. I'm paying 3 times the amount of money that I was paying when I was working full time. And what I'm asking is to consider reducing that amount of people who are retiring but prior to Medicare eligibility until I reach Medicare age. And then I've, certainly understand having to increase that amount because the amount would be less for me to have to pay anyway.
So you're saying the gap between the years of...
My retirement and Medicare eligibility.
And that would be different for each person, obviously. Right. So it might be 5 years for some, it might be 20.
And I believe most of the people who are in tier 4 have that opportunity. I believe tiers 5 and 6.
Could you?
Can't hear her.
I'm sorry, we're just getting, just kind of,
Sorry.
it's our fault. These aren't the best.
I believe
Maybe move it
tiers
closer.
5 and 6 don't really have that same opportunity. I think the age difference is pretty significant where they do have to work into their 60s if they're going to reach the, where they can obtain that percentage at 60 or 50%. So that we were just looking to find out if this is a possibility to help us for those of us who have left prior to Medicare eligibility to help offset those costs.
Like to add anything to that?
just echo what Aileen said, and also too, if you help the retirees out and someone does leave after 30 years, the county then can hire someone at a reduced salary, and they're gonna be paying, at, I believe in the current contract, it says 17%. So they're gonna still be paying, but more than the 10% that they were, after a certain period of time. And we're just looking for a fair share. We understand we're gonna have to pay something, but we're just asking the legislative body to look at our length of service that we provided for more than half of my life. I worked for Putnam County. I'm still working for Putnam County as a temporary employee. And, we're just asking to take a look at it. And we understand we have to pay something, but if it can be reduced, that'd be a home run for us.
Just want to see, do you have any comments or questions first?
That makes a lot of sense to me. I don't know what other counties do with the gap. I'm going to be in the same situation. I'm not going to be eligible for because I'm done at the end of this year. I'm going to have the same situation. I'll have some years in between where it's going to be crazy. I would like to have personnel maybe do some type of a study, or is it possible to have that type of a study? And how would we go about doing that, since everyone retires at a different longevity as far as how many years in between? You could retire at 55 and then you've got 10 years before Medicare, or you could retire at 62 and have 3 years before Medicare. It would be a difficult assessment. I think that would be something I would like to see personnel maybe create some type of a report that we can use to find out what is the impact, what is the benefit, because we also have to weigh our taxpayers as well. And I know you know that as government employees for 30, 40 years. But I think it's very valid and something that I would support, given reasonable numbers on both sides.
I know last month we gave a breakdown of what surrounding counties.
Yeah, that's what I'm looking at.
Right.
So
Yeah, very
there's-
interesting.
Right. There. Legislative Birmingham.
Yes, thank you. And thanks for your input here. It's certainly helping to educate me. And I agree with certainly the chair and Legislator Sage. We do have to have this scored in a sense to find out how much it would cost. But I think at a minimum, and John, you and I've talked over the years, and most recently as well, and Aileen and others. There's some employees retire while they're employees, they're paying 10% of their health insurance premiums, but then and making a higher salary than they are as a retiree, when they retire, most likely in all cases they're making a lesser income as retiree pensioners, but yet their insurance goes up to 30% in some cases, depending on what their scheduled pension benefit is. And I know the legislature, I'm looking at the employee handbook here, and everybody in this room who's a retiree who pays insurance, their part of their premium. If you make over $65,000 in your pension, you pay 30% of the premium, and then it ratchets down. If you make between 0 and $9,999, you pay 8%, and then there's various thresholds in between there. I think at a minimum, and again, I'd like to see this committee and then the full legislature vote on something before we begin our 2027 budget deliberations, which start in October.
Right.
So we would have to have something passed out of this committee probably in September to be approved at the full legislative meeting in the first week of October. But like I said, I read those thresholds, and right now it's pegged in at those different thresholds from 30% down to 8%. But I would like to insert in the employee handbook, and this would be through resolution, notwithstanding the foregoing, the amount of premium payable by the retiree shall not exceed the percentage of premium the retiree last paid as an employee. So to take as an example, if somebody was making whatever the contract called for, and if they were paying 10%, is that the low?
That's,
Yes.
yeah.
That's the
if
lowest.
You get to a certain point,
Yeah.
working for the county, you pay 10%.
Okay, so if you're a long time, I imagine that comes with longevity and, as far as the length of service. We shouldn't penalize our retirees for sticking with us for, that's fine. We shouldn't penalize our employees for sticking with us for the long term, only to give them a kick in the teeth when they retire to jack up their pension. So what I'd like to do, and of course through this committee and through the chair, is at least have that scored and again, it's going to be a dartboard kind of thing anyway, because each year there's different people who retire. Some people retire after 15 years. Some people and are eligible for a retiree health insurance benefit. Some retire after 41 years. So we're never going to be able to pinpoint the exact penny, and we don't do that now anyway. We have a lump sum in our budget that we adopt every year for retiree health insurance, and so that's something to think about. One thing I would mention though, and again, this is me being the broken record, we have a lot of fund balance in our coffers, and one of the assigned fund balances, and don't get all giddy at this number because it's not all going to be spent at one time, but for the last 4 years, we have had allocated in our fund balance $6 million for retiree health insurance payments that the county would have to pay. So I imagine whatever we score is not going to come anywhere near that. But thankfully, through our prior Commissioner of Finance and our current Commissioner of Finance, there is an allocated bucket of money, if you will, that is specifically for this purpose. And right now, as of December 31st, 2024, which is our last audit figures, we have $6 million in there. So, and it's been $6 million for the last 3 or 4 years. We haven't drawn anything out of it. And so it's been sitting there idle, hopefully making interest, but it's been sitting there idle. So there is some room here for us to what I would view do the right thing. And I'd like to, and again, I know there's no resolution on the floor and the committee is just discussing it at the moment. But if we're going to ask our personnel department as well as our finance commissioner to score these numbers, I think that should be the threat, the basement, so that if anybody retires and they're eligible for healthcare premium payments as a retiree, that they not pay more than they were paying in their last year or the lowest they've ever paid. So that would at least give us a floor to start with. So at least we'd have some numbers to deal with and to give some information to the committee. Thank you.
We have our acting personnel director here this evening, Adrian Iasoni. Could you just weigh in a little bit on this and just we would need a little study done, and I would like it done in a couple weeks. Is that feasible for you, or would it take longer? Only because I wanted to get this onto the September meeting.
I know.
Get
and
something.
I also defer to our acting Commissioner of Finance coordinator.
Yes, of course.
Getting those.
Right.
I do think that there's some differentiations that are important
Mhm.
that I know Aileen and John Mulroney touched upon, but
Do you want to
that
come up?
group, there's
Yeah, can you
about-
come? Could you come up to the podium? I'll get to you after she talks.
Are you kidding me? You're oh, look, he's such a gentleman. He's
gentleman.
gonna
John.
Okay,
Watch my back, John. Up until 65, right, which is what you were addressing, right? You're paying 30% of the premiums. Once individuals turn 65, there's MetaPrime 1 and MetaPrime 2. I do have some of those figures available. And there's also Medicare reimbursement that our retirees
That's the Part
are
B.
given, right? So I do have some of those numbers, but if we can clarify specifically what we're looking for and this analysis, then I'd be happy to work with the commissioner.
Okay, so I think what was discussed this evening, I think we would move forward on those particular ideas that we had and Legislator Birmingham.
I mean, just for clarity,
Sure.
just for clarity, if we could start with, because again, we can't ask you to throw a dart at the board that doesn't exist. So if we were to think of passing a resolution that would essentially state that no retiree shall pay more in retiree healthcare benefits as a retiree than they paid as an employee. And again, if we could just take a snapshot as what that would look like, for instance, in 2027, because that's our next budget year. And again, that's going to change every year depending on who retires and unfortunately who moves on to the county building in the sky. But you know,
And also
yeah.
the premium rates.
and the
right?
and of course the premium rates, yes, of course, and those always change. But at a minimum, I think that would give our retirees at least certainty as to now. When I say pay more than they paid for, what I mean is the percentage they paid of the premium, not the, just because we need to be clear. Yeah, and we could look at it both ways, but I think that's, again, because we have various constituencies, we have to, you guys are stakeholders, of course, but then we also have tax implications. So maybe if we could look at it from the percentage of the premium they paid, because right now their payments are a percentage of the premium, not a static number.
Correct.
So I think that should be at least getting us in somewhere in the right direction. And you know, I don't know if we can, since we're not locked into the premium costs that we have to pay as a county to the insurers. I think it, you know, to have everybody have something in the game, just to the percentage of the premium they paid, they can't pay more than they paid as an employee.
Okay.
Percentage.
Can I
If that's-
make a comment on that?
Well, I just want to get to the legislature first, okay? Then I'll ask for public comment.
So,
You had your hand up,
I
so
have-
yeah.
Thank you,
Mhm.
Chairwoman. I have a question, number one, if you don't mind, through the
No,
chair.
not at all.
So, what Legislator Birmingham was just talking about was a percentage. Now, as the retirees went through their steps of life, right, their percentage came down. So in their last years, it may have been 0, may have been 3%. No. So wait, hold on. Hold on. I'm in your favor, I promise. So I just want to understand, are we putting together a collaboration of a certain number when we're looking at it? And then also, so I guess I want an answer to that, because when you start, obviously that's been a big complaint of new hires, right? That their insurance premiums are through the roof and it's very high, and then it comes down as you work through it. So what number are we looking at when we're there? And then 2, I understand that the current retiree health insurance was designed to protect our retirees with lower pension benefits, and I believe that protection should remain. However, I do believe years of service should matter. I'd like to propose, we've talked about studies, that our current retiree health insurance structure and explore a hybrid approach that considers both pension income and counting years of service. The study should look at whether they can reduce individual healthcare contributions after 20 or 25 years of service, potentially eliminate them after 30 years, and also specifically examine the impact on retirees who retire before the age of 65 and are not yet Medicare eligible. As these individuals may face significant different health insurance costs, we should compare what neighboring counties are providing, examine the costs for both Medicare eligible and non-Medicare eligible retirees, and determine the actual short and long-term fiscal impact on Putnam County. And most importantly, any recommendation should protect our existing retirees so that no one is negatively impacted. So I'm not proposing a new expenditure tonight. I'm asking to run the numbers, determine whether we can provide meaningful relief without creating a significant fiscal impact on our taxpayers. If we can protect retirees with lower pensions and recognize decades of service and address the needs of those who retire before Medicare eligibility, I believe a hybrid approach could provide a fair and fiscally responsible solution.
Okay, thank you. I think, are you done?
Yes.
Oh, okay.
I'm good now.
Okay, that's I think what we're asking. Just to refresh everybody's memory from the last meeting, we look at Dutchess County, and if it's 25 plus years of service, it's 20% their health insurance premiums for retiree. Westchester County is 0. Orange County is 0. And then in Orange County, if it's 20 to 24 years of service, it's 10%. 20 to 24 years of service. In Westchester is 25%, and Dutchess County is 30% for 20 to 24. And at 25, then it goes down. So I think most people here have worked 25 plus years, a lot of people in Putnam County, right? Yeah.
Commissioner of Finance.
Yeah. Okay, the Commissioner of Finance? Yes, I'm sorry.
I'd just like to know
they have different insurance than what we have here.
Oh, I can't, can you come up to the microphone and just to state your name, Commissioner of Finance, and just so everybody knows?
Alex Gordon, Acting Commissioner of Finance. I know everyone says Westchester has a 0% contribution. They do not have NISHIP. They offer a different insurance than what we have here at Putnam County. NISHIP, I know everybody likes to say, is the Cadillac. It does come at a cost. I know Legislator Birmingham mentioned not to pay more than what we are typically paying now, but are we also taking into account that myself, I'm a tier 6, right? You're comparing me to a tier 4 who hasn't contributed to NISLRS and since, let's say they work 30 years, they only contributed for 10 years. I have to contribute until I finish working. So whereas someone else gets to keep those proceeds in their check, I have an extra, an extra bill I have to pay. And I know, the 17% or the 10% or whatever the case is, but what do we use to gauge? Our NISHIP premiums go up. We don't have anything to say how much they're going to increase or what that's going to look like in 5 years. And that's something that, again, the typical taxpayer, they don't even have access to retiree health insurance at all. They can't even, retire at some point because their jobs don't even give them the option to have retiree health insurance. Just wanted to put that out there.
Yeah, I understand that, but that's why a lot of people wanted to work in Putnam County for there were good benefits. The pay isn't as great as outside, but they're close to home. Benefits were great, so.
Right. I would also argue that, you have to work in Putnam County for 25 years to be eligible for retiree health insurance.
Yes.
That's a long time.
It is, that's what I'm saying.
January of 2025.
25.
I mean, sorry, 2005. Except, and the PBA, they are in a
Well,
different
that's
structure.
separate.
So
We're not
correct.
discussing, no, the PBA is completely different.
Right, exactly.
Legislator Birmingham, you had your hand.
Yeah, just to echo a little bit about what the acting commissioner of finance was saying, and I know Dot Trottier I think wants to speak on this as well. I don't disagree with everything you're saying, and we have to be careful. We don't want to make the perfect the enemy of the good. You're right. Tier 6 people have to work, have to contribute their pension payments for the retirement payments to the state for their state retirement till
A percentage
till but we can only control what we can control.
Mhm.
The state set that up, and there was a fix to 6 this year that didn't address that issue, but
Right.
addressed the 5-year vesting period. So I think we should focus on only what we can control. And with respect to your very valid point about, and again, I know Dot's probably going to address this because she stepped up when I mentioned earlier. My proposal would be, and again, just for scoring and informational purposes, to let us know in a 2027 hypothetical budget, what would it cost us to have everybody who retired pay not more than what they paid as an employee, to bring it down to that level. I think that's at least a good first step. And when I say pay not more, I mean the percentage. And I think that's the point that Dot probably wants to disagree with me on, but and that's fine. But at least in a basis for that to start a discussion and then maybe work down from there. Because we do need, it's unfair for us to ask you to do something and just give you what do you think? I want to give you a definite scenario.
So I'm so sorry, just for clarification purposes then, are you referring to those county employees that have since retired? Is that what we're looking at? Everyone that's
Yes.
retired
It would be retroactive to, who's when I first started here, I think there was somebody who retired in 1952 that was still getting health insurance. And might still be, I don't know. But yes, anybody who's currently retired that's getting health insurance now, I want those figures to be taken into account. That's what I want scored along those lines. Thank you, Madam Chair.
I'm just going to ask any other legislators that didn't have a chance. I know you're on the committee, so go ahead. You can.
Just one clarification. We're talking about, in Legislator Birmingham's proposal, we're talking about potentially people who have been here for 25 years or more. Is that the pool that we're talking about, or is it anybody? Anybody. Okay.
Because there's some people who were hired before 2006, which was our previous cutoff, that, they wouldn't be still employed by us now because just by the dint of time. But there were some people who were employed by us prior to 2006 that have since retired that only had 10 years. I think the threshold was 10 years back then, not 15. So yes, anybody, my pool of people I want to have scored is anybody who's a current retiree now, take what they are paying now, and we have that figure today, and then analyze that to the percentage that they would have to pay at their last employment date for the county. So if somebody retired, for instance, in 2000, well, actually, I guess, yeah, that would be the difficult part.
It would.
But it's doable. You need a big spreadsheet, but and some of it might be estimating. But we would like to see what employee X, Y, and Z paid as an employee. If we were to reduce that percentage, their retiree percentage down to that, what that would look like. It's not easy, but it's doable.
Any other legislators? No. Legislative council wants to say something.
From a legal standpoint, there's a couple of factors that have to go into any resolution for this, because there was a Donahue case in 2022 that specified a court cannot impute a never-ending right to insurance, and that you have to have an instrument that sets forth the basis and term, and conditions under which it would be subject to change, because contracts have a term, and even if the genesis is a resolution, it's still a written instrument, and so it has to allow for what the terms of and flexibilities of it are. So you'd have to specify what gave the right to the insurance to begin with, which might be different depending on the employee. Was it the basis of a contract? Was it, management hiring? So that would have to be specified. And then it would have to be specified whether or not there is any circumstances under which it could change, and what are those circumstances under which it could change? Because what if there came a time when, I hope not, but that the county was, just insolvent in some way, couldn't keep up with the demand of these things? What would then be the terms, and what would be the obligations? Because the court will not impute a right for insurance indefinitely. The court is going to look to an instrument, and an instrument that fails to meet those terms is not going to be upheld. So in order to prevent retirees from having a problem, and God forbid there were a circumstance like that, where the county was not able to keep financially up with the demand, in order to establish the rights of the interested parties, we'd have to make sure that the legislation covered that.
Yeah, along those lines, if I could, all I'd be suggesting would be to amend what's already there, which is exactly what you're talking about. In an employee handbook, it does say that, and I imagine this is embodied in a resolution that was adopted before, that the legislature always has the opportunity to change for better or for worse. I wouldn't look to tamper with that. This would just merely be an amendment to what's already there, and specifically only for the revision of the schedule that we have now.
Do you know when that an original thing was drafted? That's why I was mentioning it, because it was 2022 that the Donahue case came out, and I don't know whether it was ever revisited for that purpose. And it might satisfy it. It might be fine. But it was just pointing it out since we're looking at it.
It was around 2019 or so that they changed what was in the handbook, because when I retired, that wording was not in the handbook at all.
Okay.
So I retired on the basis of what I was paying when I worked, and 2 years later it went up 500%. So just so you know, that wording is fairly recent.
Yeah.
The history of those of us who worked 35, 40 years.
So if assuming that 2019 is accurate, the Donahue case came out after 2019, 2022. So we'd want to take a look probably at this legislation and just make sure that it passes the scrutiny that was set forth in the Court of Appeals case.
Through the chair, could we rely on you to help us with that?
Yes.
Thank you.
I would hope so. I'm going to ask for any other legislators before I call on Legislator Crowley, because you've commented already. Anyone else? No? Okay.
I just want to bring up again too, I think we need to bring up the fact that we have Putnam Hospital here, which has very limited services. And again, I brought this up last time, Columbia Presbyterian or NYP. It's every month we're getting an email or something cutting out services, or we're night shift, you're on your last leg here, you have 30 more days before we're not going to be entertaining your insurance anymore. That's where a lot of patients go. And you know, if you're on a fixed income, again, driving down to Westchester or Dutchess or wherever you're going it's not going to help the problem. So being the Cadillac of insurance, it doesn't seem like a Cadillac to me if hospitals are cutting it out and making us drive further and our rates are going up through the pharmacy. So I think we need to take that into consideration. And we're good right now, but you know, I don't know how much longer they're going to hold on.
I think that's a problem across all, across the board, everywhere.
It is, but
with the healthcare
that's
and
a big one for us, though. That's where we go. We go to Columbia Presbyterian for a real hospital, so to speak, but that has a lot of services. And Putnam doesn't offer that. Or you're going to Danbury, and every month we're getting something saying, "Well, you have 30 more days." You know, that's where our doctors are. So we're going to be traveling more. We're going to specialty doctors. As you get older, you have more problems, and you know, it's just a problem. Even wear and tear in your car, roads, everything else. Like, let's look at it as a whole.
Okay, so you can work something up. I know you have an idea, basically, and we'll talk about. Now I'm going to get to the public. Okay, so no more. Anybody else from the legislature? No. Okay, from the public, please come up and state your name.
I want to just talk about what Mr. Birmingham said.
Can you state
if I understood it correctly?
Can you state your name? So.
I thought everybody knew by now. I'm Dorothy Trottier. Everybody calls me Dot. And I want to correct something last time. I said I worked 41 years. I did work 41 years, 31 as a full-time employee, 10 as a retiree. I came back as a retiree. So when I retired in 2006, I was paying nothing for my health insurance. Zero. The following year, it was raised, and Mr. Hill, Tony Hill, was saying at the time, don't think it's never going to go up. Well, it certainly did. The following couple of years, I paid $400 for a family plan for a year. This year, I paid $4,214. So the retirees are going up, paying their fair share. I have not heard since we started this, how many retirees are we talking about that have the health insurance? I've never heard the number.
That's a good question. And I don't know, do we have that information tonight or?
I do.
You do? You do? Okay.
Right now we have and this was as of July, so last month, we have 341 on insurance. We have 290 Medicare eligible employees.
That was my other question.
So, 290, so we have 341 total, 290 Medicare eligible employees and 51 that are not Medicare in the whole.
Well, my point too, that's why I wanted those numbers too, because once you go on Medicare, we cost the county so much less. We really do. A full-time person costs the county for a full-time plan, this year, $43,965.48 for a family plan for the night shift. A retiree who's getting Medicare, which the bulk of us are on Medicare, we cost the county $19,599, of which I pay $4,200. So the county pays $15,000. They're paying. I just not quite understanding why we have to considering always having to pay more. I paid. Since I've retired, it has gone up from $0 to $4,213. Retirees are paying their fair share every single year. It does go up. I am in the bracket of the 21.5%. There's two brackets higher. There's retirees paying 25%, and there's retirees paying 30%. So we are paying our fair share. So it just seems to me, as Mr. Birmingham is talking about this surplus unencumbered funds for the retiree health insurance hasn't been tapped into. You said $6 million in the last couple of years. Why now are you coming after us as the retirees when I'll bet you if I ask every retiree in this group, I never even used my health insurance when I was an employee. I paid a family plan. I worked right next to people who were husband and wife who had 5 kids. We were all paying the same thing. I was considered a family, a husband and a wife. I just don't understand it now when when they say a fixed income, we are on a fixed income. How many in this have gone into the hospital in the last, I've used my health insurance more in the last 3 years. My husband got cancer. I had acute renal failure. I've been in and out of the hospital. He's been in. We need this so much more now than we've ever needed it before. And yet we're paying our fair share, and yet you're coming after us. I don't find that honorable. That's the only word I can use, honorable. It's just not fair. So I said my piece.
The commissioner has
The public just.
No, go ahead. That's fine.
Oh, okay.
Don't leave that out there.
Okay, he would like to just speak for 1 second, then if that's okay.
Addressing all, the idea that anybody's coming after retiree healthcare or anything like that, it's the exact opposite. Members of your community have come to us and asked for relief. So this discussion is not the county or the legislature looking to get more from you, Dottie, or everybody here. That's not why you're here.
Then why did the employees go down to 17%? If the community is coming to you about the cost of health insurance, why this year did full-time employees go down to 17%?
Dottie, if I can reiterate that, the reason we're here tonight having this discussion is because members of the retirement community have come to us asking for relief on those increases that you talked about. We're not here tonight asking more out of your pocket. We're considering.
Most certainly. Oh, Dottie, please, Dot.
No, we're.
looking for more.
Oh, no.
Okay, I'll clarify that then. Let me clarify that. So, thank you, yes. Okay. Oh, of course. That's why I brought this forward. We are looking to reduce the payments that you have been paying.
Reduce.
No, not.
ask for.
No, never. No,
Who
that's
said
why we're
that?
here. I don't know. No, nobody. People might have thought that.
That was on Facebook or something, right? Sorry.
I'm sorry. Well, thank you for.
Hi, Rebecca Wittenberg. I worked at the health department for, we'll just say 30 plus years. I started when I was 10. But, couple of things. One is I just wanted to make sure you realize how recent those clauses are in our contract. When most of us that are in this room were hired, we were told that whatever we paid when we at the end of our service is what we would pay in retirement. When I planned my retirement and figured out the funds and whatever, that was part of the calculation. 2 or 3 years later, it went up 500%. That's a big hit in 1 year. And I think it just has to be reminded that that's a really new clause. Also, I was on the health insurance committee for the county for about, I don't know, at least 10 years, maybe longer. I know back in about the years go by, 2014 or 2015, an entire printout and report was done of every retiree, how much we paid our last year of employment, how much we were now paying percentage-wise, what it would mean if they changed. It was working towards that new language in the contract. So yes, you have work to do, but if you can find that report, I may even still have a copy of it because I just don't trust anybody and I don't get rid of things. But it was beyond comprehensive. And it just showed, and it was amazing how many people were not in a percentage, because several people retired before 20 or 25 years, and figuring out that kind of thing. So there was a report done. It should probably still be there in the computer in the file somewhere. And, I do know we've lost some of the members that were on it, but a lot of them are still there. One of the other things I've mentioned, and I don't know if the counties could ever join some forces together, counties that use the Empire Plan. One of the negatives of the Empire Plan, and I will tell you, it has, helped me through several processes also, both when I was working and in retirement. Many insurance policies have employee plus one, and family. The Empire Plan does not have employee plus one. I do know that there might be some of us out there, but the people here I know that have, more than plus one living with them that would need health insurance. But the majority of us are now employee plus one. And if the Empire Plan would consider doing that, then the $19,000 is costing Putnam County for retirees for the health insurance would go down because we are paying the family rate. Just we're Medicare eligible, so it's a lower amount. So if we were paying, if they would have the plus one, that number would come down right away before you do anything else. So I think you have to look at that and consider it. And I do think, and it sounds like you have to consider, we were encouraged with our good benefits where I could have made $20,000 to $40,000 by traveling not too far, but I didn't. My commitment, I've lived in Putnam County my whole life, as has 3 generations of my family. But it was a commitment here, but it was also, look what you're going to get when you retire. And then 2-3 years into retirement, that blew out by like 500%. So it's a real balance that you do have to consider and you do have to look at. And I always feel like if some of the counties joined forces, the Empire Plan might have to get pressured to do what almost every other insurance plan does, which is that employee plus one. It would help a great deal. But the report is important. I know the basis of it is there. And I think it is fair and reasonable if we work 34 years to suddenly go, change that formula. And because for most of us, I think probably almost everyone here, we left with one understanding. And then the formula changed 3 years later. And I think Social Security went up by about 2.2% that year. Didn't even come close to that 500% increase. So I'm just asking you to look at that and consider that, please.
Yes, thank you. Thank you very much. Oh. Yes, you can come forward. Is that Patty? Patty? Yeah, you both can come up. Okay.
I just want to clarify the Cadillac comment.
Cadillac.
So a lot of people who have NISHIP, there are people who have cancer, unfortunately. They go into the hospital with this horrible disease with the NISHIP plan. I use NISHIP as an example because it is the most expensive plan that Putnam offers because we do have MVP and we also have Benestar. You go into the hospital with this horrible disease. Bills, obviously, we know healthcare, astronomical. They leave paying maybe a $30, $35 copay. That's what I mean by the Cadillac of insurance. I know it is costly, but when you do need it, it is there. Hopefully, nobody needs it. But that's what I mean by the Cadillac of insurance. Me personally, working, my daughter had an allergy. Horrible, allergic to milk. Formula is expensive. NISHIP covered it. I didn't have to pay. So for me, it was a benefit, So yes, it comes out of my check. It is expensive.
But there are benefits.
But there are benefits to what I'm paying for. So that's what I meant by Cadillac of insurance.
Thank you. Thank you.
Patricia Rao, Principal Personnel Specialist. I am the active HBA for the county right now. So I did want to address the Empire pricing structure because I'm also in a 2-person household that is on a family enrollment. So I've asked NIBES this directly. I do attend a statewide webinar with NISHIP annually ahead of them releasing the new rates. And the reason the state has given for the 2-option only structure is because when you start separating it out, it actually drives up the monthly premiums for some of the other tiers. So if you look at MVP right now, which does offer the individual plus one, individual plus dependents, or family option, MVP family, despite being an HMO, costs more money each month than Empire family. And the reason for that is that tiered structure. So just to provide some clarification on how the state has explained the reasoning behind the individual and family, because I'd love to pay employee plus one, but not if it meant over the long term I was going to end up paying more. because I am also a night shift lover and user. So no one's ever going to take it away from me. And I will continue to pay the family rate, but I know it's something that gets brought up a lot. And so since it was asked here, I did just want to address that.
Thank you. Thank
Yeah,
you
of
for
course.
clarifying that. Okay, so I wanted just to, people have mentioned here this evening, I don't know if anyone else wants to come up, anybody from the public, you can still come up and speak. But I just wanted to mention in 2008, and I think that's what a lot of people are talking about, it was if you had 16 years of employment or more, you paid 10%. And that was from 2008. So I know a lot of people were talking about that in the past, and then it just jumped up. Legislator.
Just one final point on this. I want to thank everybody, and I know we all do, for coming out here. And to reiterate Legislator Regan's comments, we're trying to make things better. That's why we're here today. And I may have given that. I hope I didn't transmit anything other than that. We're trying to make things better, and to decrease the amount that retirees have to pay. So that's why we're here tonight. And I saw you jump up, and I got nervous.
I got a copy of the chart this year.
Yep.
And that's not what I got from, every year, the retirees were on that chart.
Yep.
Of the cost for NISHIP and MVP. This year, the retirees were not on the chart. So I got a little nervous that you will, I have the chart too.
You do? Oh, I wonder why.
Every year, since I've done charts, that's just my thing. For nobody's pleasure but my own. Every year I looked at the chart, there were prices for employees and prices for retirees. This was the first year the retirees were not on the chart at all.
And naturally, your antennas go up with that. I get it. No, that's, yeah.
I got a little nervous.
Yep, yep.
And I like the Cadillac.
We all do.
My husband went into Lenox Hill down in New York City for an ablation. We got a letter from Medicare for one night was $389,000. Medicare would not pay a penny to Lenox Hill. And they wrote us a letter. My husband's Medicare card was hacked down there. And we got a letter from Medicare saying, you are not to pay a penny of this. So it's not just a Putnam County problem.
No, of course not.
This is nationwide health insurance costs. But when I didn't see the retiree breakdown on the chart, I got very, very, very nervous. I can honestly tell you that. I had my husband up nights. We're going to be drunk.
No.
Okay. You made my day.
You should have called the legislature right away.
You made my day.
Yes. Okay. Adrian, did you want to say something? You were done?
No,
okay.
just asking for clarity.
Oh, okay. John, did you have something else you wanted to add?
Yeah, I just want to thank you, the body here again for the subject at hand, because I know it is a tedious project, and hopefully you guys will follow through, and hopefully there will become a resolution. Aileen and I have been talking about this for the last couple of years since we retired, and we put a letter together, and you guys have answered it greatly, and I just want to say thank you.
Ditto.
You're welcome. You're welcome. Okay. Oh. Yes.
Only because I could never allow John to get the last word. I have to reiterate the notion that was spoken about before here, and in somewhat contrast to our acting finance commissioner, about other avenues of employee that don't provide retiree benefits, right?
And don't get reimbursed for Medicare.
Absolutely, and those are career choices that are afforded to people when you go into any particular industry that may have a higher salary and all the other things. But those employees who come to work for Putnam County implied, and even sounds like it wasn't even implied. It sounds like it was said, right? We're promised something better.
Right.
So it's, I think, while I absolutely, give nod to your financial management, I think we do have to keep that in mind, is that for this generation of retirees, they were promised something that doesn't seem like we're delivering on. And, right, we learn from that. So we can always be clear going forward. The person who we hire tomorrow will have a lot more understanding of what the parameters are. But if it was implied or even more, I do think we owe to our retirees a good look at the situation. Thank you.
Thank you.
Thank you.
Okay, good. Okay, thank you very much.
Thank you.
Thank you, guys.
I have my homework.
Yes, you sure do. Huh? No, Patricia is.
Thank you, everybody.
Thank you all for coming this evening.
Including us.
Thank you.
Thank you for coming. Thank you. Okay, moving on. Do you hear that?
We're gonna talk dogs now.
We're talking about dogs. Okay. Moving on to number 4. This is approval for amendment to the county service animal policy. And we have this evening, just introduce yourself for the camera.
And Patricia Rowgan, personnel specialist. This is a very
Yes.
minor change to
Minor.
our existing service animal policy.
Mhm.
As you can see from the policy as sent in, we are hoping to just add a small section at the end of the policy that will allow a therapy dog or a comfort dog at the CAC. As you know, the work at the CAC is incredibly important, and the families that have to go to the CAC are dealing with just unbelievably stressful and distressing things. And so it's to support that program. I've brought Margaret, who's obviously in charge of the CAC, so she could speak more to that if you had any questions. But that is really the whole.
Yeah, no, I'm absolutely in favor of this. I think it's wonderful. I just want for everybody to know that the difference between, because some people have a therapy dog and then the service animal. So as far as that goes, the therapy dog provides emotional support, and they're legally not considered a service animal under the ADA. So we're asking for the therapy dog to actually accommodate the needs in that, and I'm absolutely in favor of that. I think that's wonderful. So you could speak on the need from your standpoint, if you.
As Patty said, the purpose of it would just be to have that presence that's very calming and assuring to mostly the child who is in crisis. And studies have shown that, particularly because we're asking the children to talk about some complex things that can be really difficult, and just having that calming presence there is just soothing, and it's supportive to children and families.
Absolutely. I'm definitely, like I said, definitely in favor of that. Okay, do you have any questions or comments?
No, I just think it's a wonderful idea. I couldn't think of a thing that I would change on this. I went down a big black hole on the internet researching therapy dogs and the types of conditions that they're used for, and I think this is a perfect marriage, I guess you would say, with a child coming into the CAC. If any of these legislators had to have an opportunity to go into the CAC, you know that it's a warm, welcoming, wonderful space. To have a therapy dog there to meet a traumatized child, I think is just it's great to have them work through a situation that they're unfortunately brought into the CAC for. So I'm absolutely in favor of this.
And you can also use a pony. They have therapy ponies. Yeah. Do it. Council has something.
Through the chair, is there any provision made for, because I know this CAC is a limited space, is there going to be any differentiation between rooms where the therapy dog is used to account for allergies and things like that, just which, can be more prevalent and more serious in children versus adults?
So we do have a policy in place that we reduce the screening beforehand. So we would only bring the dog on site if it was, agreed by the family, and that we made sure that there were no And, there would be a separate, the dog would protect the handler in a separate location and only brought to interact with the child and the family.
I guess my question was also just it's exposing the space to the dander. And so is there going to be a room that is, like no carpeting so that it could be easily cleaned and remediated? Because if you have carpeting and things like that and the dog is regularly brought there, if someone had a severe allergy, you wouldn't do it. Like, I mean, they do that sometimes at, certain offices. They have like, this is the animal room, this is the non-animal room, so that you don't have that exposure risk.
Yeah, we could definitely make those arrangements with separated.
You have a separate space, a separate room just for that. Yeah. Okay. Or you get a poodle. I do. Anyone else? Any other legislators?
No, I was
Let-
actually gonna ask the same question that council just brought up about the dander.
Huh?
Yeah.
Okay, Legislator Regan?
Thank you,
Yeah.
Chairman. So, and I read this proposal, prior to here, but what I'm not sure about, does it provide for your discretion? Because despite all of the niceties that we talked about, right, sometimes people will come up with animals that are not service animals and other things. Does the new policy provide for your discretion to look at a situation and say, this might not be best for the CAC? I read it a couple days ago. So I don't
Just for clarification, do you mean the specific dog that we?
A specific animal, yes. But an animal or specific dog?
They have to be certified and have to go through specific training.
The emotional ones would not though.
No, training, but not ADA. They're not, yeah.
There's that special training that
Mhm.
They have to be certified.
with the handler.
Mhm.
And they have to keep that, certificate up to date. So it's every 2 years, the dog and the handler have to get retested. And then we would keep documentation on site with the certificates for both the dog and the handler.
So if you've got that, great, okay, because there were different circumstances where I've seen that where someone walks into a particular facility, says this is my emotional support animal.
yes.
You have to.
Yeah,
But that does, I'm saying that does happen, I've seen it
So
firsthand.
that is a separate category of animal, which our policy, very specifically excludes. So the public and our employees are not allowed to have service animals. The only kind of exception to that are these certified therapy dogs, and it is in large part because they go through certification process.
Great, okay, so you've got that discretion, great, thank you.
Okay, anyone else? Yeah, Legislator Goldman.
Is that against the law, council, to not allow horses, because you're allowed to get horses for therapy animals? Just allow specific dogs?
It depends what the qualification is of the animal. As Patty was explaining, there's ones that are sort of colloquially used, that this is my support animal because I find it supportive. And then there are actually certified service animals, like an animal for the blind or something like that. It would be illegal to exclude an animal that is certified in order to assist on a disability in that nature, and that has a specific definition under the law. And that's what she was explaining, is that ones that are certified under the law are permitted, ones that are, sort of just emotionally supportive to someone and not certified in that way are not. But specifically for the CAC's purposes, they are having a specific qualification for the use of their services. So obviously if they had a child with disabilities, for example, who had a seizure disorder, and this was a dog medically necessary to alert them, they would have to alert the CAC, and that would be permissible because it would be illegal to exclude such an animal. However, if I have, I don't know, emotional support chinchilla that makes me feel better, I can't just bring that to the CAC.
Could you certify your chinchilla?
No, there's no real thing under the law just for emotional support. You have to have it as a qualified, trained, certified animal under the American Disabilities Act, and that's the distinction that they were trying to accomplish.
Mr. Montgomery.
Yeah, I was opposed to the 2023 policy adamantly. I'm really supportive of the Child Advocacy Center's mission here to provide these wonderful dogs, because I know firsthand they do a lot to support those those situations, don't want to throw a wrench in this, but I would go as far as amending this to, rather than have it say B, Child's Advocacy Center, I would say therapy dogs. And I would say certified therapy animals may be allowed, period. The animal must serve as an express purpose related to therapy, such as providing psychological and or emotional support. The animal shall not be the property of Putnam County. Putnam County shall not be responsible for the feeding, housing, or medical care. Then the second paragraph, therapy animals, cross out child advocacy.
Oh, so you're saying to allow them everywhere on the campus of the county campus?
I've seen this, after we passed this policy, I've seen this happening at Putnam County buildings and people, just turning away. I'm all for that because I know the value, I know how traumatic it is to work here sometimes, and people who need therapy dogs, and it's,
We can bring them in here to the legislature?
I would get mine certified tomorrow.
If I may, under the ADA, there are psychological service animals. So if someone does have a mini horse or a dog, which is what is allowed under the ADA, that tasks for them in a way that is related to a psychological need, such as deep pressure therapy for someone having an anxiety attack, or a dog that can detect when their owner is about to have an anxiety attack. Or things like that, that is completely allowed under this policy because that is allowable under the ADA. The reason we kept it very tight is because it can become very hard to regulate, and people may think that their dogs are well behaved and they are not. And we have a lot of different campuses and a lot of employees with a lot of different kind of work environments and some very public offices. So by expanding it, I think we really are opening ourselves up potentially to some issues. If someone has a legitimate psychological service animal that's helping them, there would be absolutely no problem with them bringing those animals into the county properties.
But again, like you said, it's very specific and usually medically related. I don't know that it's always, if someone's suffering from anxiety.
Yeah, it was just the example I used.
And needs to. That's I don't know that those undefined or hard to diagnose mental health issues where someone does have a therapy dog, a certified therapy dog, in the sense that there are under the ADA even, like the Child Advocacy Center is not necessarily, they're not bringing in service dogs, they're bringing in therapy dogs. They're defined very differently. And so what I'm saying is why make it exclusive to the Child Advocacy Center, that's all.
So one piece of this is also that there are insurance implications. So there were insurance forms in my packet that are approved by the law department and the risk manager. And so if someone from the public was coming in, we'd be trying to hand out and stay on top of all these different insurance requirements. It requires turning in information to the law department. So just from a management perspective, it can very much become a runaway train.
I get it. I mean, it's obvious to me that since we implemented this, there have been exceptions of dogs being allowed that don't meet the requirements, and I'm in favor of that, and I'll stick to that. And I understand the limitations and your job. I just am for the dogs.
Let's go into the. I think what you're proposing or thinking about would be a separate from this. I think we need to protect the Child Advocacy Center because, like you said, some people could abuse it and then it could harm you. You're looking for this just for your.
Well, the reason we have the
but then
2023 policy, somebody was abusing it, and that one bad apple ruined it for everybody.
Maybe we could do two, is what I'm saying, two. Maybe for them, separate, then maybe we could think about something for the county.
Well, it is included in our county policy.
Yeah.
Thank
you. Council.
For listening to me. I appreciate it.
Through the chair, I couldn't have said it better, that each circumstance where we're going to do this is going to bring new risk. Like just even in the small space of the CAC, I pointed out, well, what if a child who's coming to the CAC has a severe allergy, you know, and how have we accommodated for that? Because that also is a disability. If you have an anaphylactic reaction to something and that is a disability that you hold, we have to try our best, you know, within our reasonable thing to make accommodations for all forms of disabilities and to try to anticipate those things, which is part of the task of risk management and something that the insurer has to have an opportunity to weigh in on as to whether they think that our policy is adequately anticipating the risks that are inherent in these things. So it's not that we couldn't perhaps provide for this, but it would have to be done in conjunction with our insurer and have a plan depending on the space. Because the smaller the space, the less able we are to segregate the animal from someone who's potentially allergic to the animal. And the lasting effects of dander, you know, can sometimes, you know, not easily be mitigated in certain spaces. Like here we have carpeting. It's very hard to remove dander from carpeting, even with deep cleaning and things like that. You need UV lights and things to kill, you know, the mites that create the protein, you know, things that people are allergic to. So the idea is that it isn't impossible. It would just require a much larger scale analysis than was done or envisioned for this process.
I do have another comment, but I'll wait.
Sure.
If I may, if I could just, I'm well aware of that, and I do appreciate that. We've had dogs here. Sometimes I walk into the lobby and there's one of our dogs there, and I get it, we're covered under that, but there's going to be some kid walking in this building with a severe allergy, and that dog has been here. That's all I'm saying, is that it happens here all the time, and I like that it does. I'll be quiet.
Not the allergy part, though. Yes.
I just had a question. I mean, listen, through the chair to council, how do you, like, I understand where you're coming from because you have airlines that have no pets allowed at all for dander reasons because they don't disinfect. But then you also have people that come from the house, like I come from my house, I have my husky's hair all over me. So, you know, like, that child is going to be exposed to dander and dog hair. So how do you
You can't prevent every circumstance. All you can do is to reasonably anticipate things. And if we're on notice that a proposal has been made regarding animals, we have to do our due diligence to, you know, reasonably anticipate what are the risks inherent in that and show that we've done due diligence and tried to meet the standard of care. And what a county or municipality is expected to prepare basically comes from worst case scenarios. And so you have a case somewhere in, you know, Onondaga maybe where this happened and someone had anaphylaxis and a child died or something horrible like that. And then you look at what they did and whether the court determined that it was adequate or it was inadequate and whether the court found liability or didn't find liability. And, you know, insurance carriers analyze these things on a regular basis from these happenstances that happen. And so, of course, we can't guard against every single, you know, unique circumstance that someone has, and sometimes you don't even think about these things until something bad happens. And so the idea is by starting narrow, we have this, we've come up with a good plan, we figured out how to segregate it, we figured out how to reasonably anticipate the needs of the people who come to the CAC, and, you know, we see how it goes here. And then once we see how that goes and what things work, what things don't work, what adjustments have to be made, it becomes more reasonable to expand. And so the idea is just to be cautious and thoughtful and, you know, take that into account, you know. And I love animals too. I have a million animals. I'm allergic to all of them, by the way, but that's what I have an allergist for. So,
I'm in support. I just want to go over it.
Thank you, and thank you for the discussion. I think the moral of the story is I'm thrilled that the Child Advocacy Center is using therapy dogs, and I hope this helps you be we'll use them.
Thank you.
Thanks.
Thank you so much.
Thanks.
Okay, moving on to number 5 is FY. Oh, I'm sorry. I'm sorry. Yes.
Public comment.
There's no, well, public comment? Yes, approval. I make a motion to approve the Putnam County, what? I'm sorry.
I think we probably want to put it as you know, orally amended, because we did provide that there was going to be a separate space, and I think that we should codify that we have.
We didn't amend it.
I mean, they clarified. I think it was with that clarification.
I do have a question about that.
Yeah.
No, we didn't amend anything on this. No.
If my understanding was, countywide policies that affect all employees must go through the legislature, but could the CAC have their own internal processes and policies that would not have to appear? I think that it was my understanding from the conversation that would be more of an internal CAC policy.
That wouldn't have to do anything with tonight. That this is, we're just approving this policy. Okay. So
I guess the only issue is that is the resolution complete in terms of the policy without it, I guess would be my question. Is there inherent risk in passing something that doesn't provide for a known and anticipatable risk?
what's the rest?
It just specifying that there will be a segregated space
Oh, segregated space.
for the animal versus, non-animal for the purpose of people with allergies.
Can we add that now? Can we?
For me, I think, I'm on the advisory board for the CAC. I think they're perfectly capable of managing their space.
Mm-hmm.
And I would certainly leave it up to their discretion as far as managing their space and their allergies. I don't know that needs to go into the.
I don't think it has to go in then as a, yeah.
And I will just share that, we do have a policy for this, that can easily be amended, and I'm happy to share that too.
Through the chair, my concern is not that the CAC, I know you guys will take care of this. I have no concern that the CAC won't do what they're supposed to do. My concern is that we are putting something through as legislation that doesn't reflect that. And, we don't know in the future who will be at the CAC, who may be, as, I would hope would always be as diligent as our current CAC. I know they are. My thing is that it's not reflected in what we're doing. And
So we can maybe we could send this to audit, if we could just amend it?
Aren't we just amending?
Or could we just amend it tonight? No.
No, this is not financial. Won't go to audit.
Amend it.
Just leave it to the CAC.
Well, that's what we're saying,
Yeah.
but yeah.
Are we, through the chair,
Go
are
ahead,
we the carriers of insurance for the CAC? We hold the insurance, so then that would make us liable if we don't amend it. So has it gone through risk to look at this, or should it go through risk and then be brought to the full to be amended as such? Because if we're the carriers of the insurance, it should be written appropriately so that it doesn't, so we're indemnified.
I did work with Matt Bruno.
Okay.
So Matt Bruno has reviewed the policy, and
Okay.
he's the one who provided the insurance documents, which were amended to reflect the
Okay.
So the insurance policy was already amended.
I
Regarding.
can't speak to our standing policy,
Right.
but I can tell you that Matt Bruno reviewed this change to the service animal policy and provided those two insurance forms that were. sent
Right,
in
but
with
the separate room
policy.
wasn't in there.
Those
The
were-
separate room was not included because that was just brought up this evening, because we didn't, think of that.
So could we just to address your concerns is maybe under one of the, I'm sorry.
No,
through the chair,
no,
I
yeah,
apologize.
that's all right. Yeah, maybe we can just amend it right on the floor and then, right? So, okay. So let me just get to that page. Go ahead.
So
you
I'm
have it in
looking
front
at
of you.
the resolution, and it comes down to, let me look, let's see.
What page?
The first resolved says that the special exception will be made for therapy dogs at the Children's Advocacy Center. And then maybe a second resolved underneath that saying.
I think you could just say in the designated, room, animal room, or with designated
And it does.
designated space.
Yeah, just in that first resolved.
Yes, just
Add wording behind the first resolved stating that they would have a
in the space designated by the Child Advocacy Center.
CAC animal room. Okay.
A separate room. designated room.
Yeah.
Okay. I will make that, I'll make a motion to amend do I need to make a motion to amend the resolution attached? So I will make that.
Yes.
Make that motion.
Second. Sorry, second. All in favor?
Aye.
Aye.
Madam
Okay.
Chair, Matt Bruno's insurance is also there too.
Right. So we'll just made a motion for that. Seconded. All in favor?
Aye.
Okay. So now we're going to vote on the amended
Correct.
version. Okay, I make a motion to vote on the amended Putnam County Service Animal Policy. Do I have a second?
Second.
All in favor?
Aye.
Aye. Okay, very good.
Thank you.
And moving on to number 5 is FYI for the accident report. Number 6 is FYI for the incident report. Number 7 is other business. Seeing there's no other business, I make a motion to adjourn. Do I have a second?